In this short video, I want to provide a little bit of context regarding Genvoya or Stribild and the how and the why it affects generic Viagra or sildenafil prescribing. I get this question a lot from patients. Obviously, if this pertains to you as a patient, you need to talk to your doctor and ask them, make sure they understand what you're taking and how often you're using it, because it can have some really significant consequences, which we'll get to in a minute. But basically, Genvoya is a combination of 4 drugs that you can see here listed on the slide here. Some boost the effects of others, and some interact with each other, particularly the sildenafil. So the common prescribing recommendation per the manufacturer is that when using generic sildenafil, that the 20 milligram dose is the maximum daily dose. And when I say daily, I don't mean every day. I mean no often than every 48 hours. This is what the manufacturer suggests. This is not me coming up with this on my own. Be sure to consult your local doctor. They may have some other ideas based on unique physiology, pre-existing problems, particularly kidney problems, as a lot of these drugs are excreted and metabolized in the kidney itself. But just be aware that there are a variety of issues at play. The Cobostat can increase blood levels of sildenafil, which can result in low blood pressure. Worst case would be priapism, which is a prolonged sustained painful erection that requires emergent treatment in the ER. I've treated several of these cases in the ED myself in the past, and sometimes urology needs to get involved and surgery is required. Cobostat actually increases the levels of some of the other components inside Genvoya, and it's designed to kind of boost the effects of some of the other HIV medications. So there's also food interactions with these. Sildenafil doesn't work very well when there's food in the belly, particularly fat. It tends to bind the drug and delay absorption and results in a very unpredictable or poor effect. That's very common. Alcohol is another interaction with sildenafil and tends to dampen the effect. Also potentiates low blood pressure, which can result in dizziness, lightheadedness. Other worrisome side effects such as vision changes or hearing changes can occur as well. So obviously there's tons of drug-drug interactions. Most clinicians use a robust prescribing program that can do some of the checking for us. Sometimes it requires 2 different programs to get the job done. Fortunately, with AI and the advance of technology, this is going to be much, much easier. But just take this to mind. Be sure to discuss any medications, new, old, changes with your local physician to make sure that you are safe and to make sure that there's not interactions or contraindications. I see a lot of patients that borrow medications from friends or family members and sometimes get themselves in quite significant trouble. So don't let that be you. Talk to your local doctor.